As a young woman, Rachel Phillips would glide across the stage, dancing in iconic ballets like the Nutcracker. But little did she know what was making her body so flexible on stage would make her life so miserable.
Whenever I hit 30, my body just started falling apart with one thing after another.
Rachel was diagnosed with Ehlers-Danlos syndrome. It's a genetic disorder that makes the body's connective tissue weak. For Rachel, it means joint pain, but it's also impacted her trachea, better known as her windpipe. The back muscle wall of her trachea became very loose.
So rather than being a flat like this, it would actually bulge into the airway and completely occlude it when she would cough.
Rachel was seen by doctors at some of the top hospitals in the Northeast, but nothing helped. She had to use a mini ventilator to keep oxygen flowing. She finally decided to go to Sweden for an experimental trachea transplant. But before she went, she had to undergo an evaluation, and that's when she met Dr. Weinberger.
He said, I think we've got a few more things we can try.
One of those ideas was to use Botox.
And so the thought was, if we could paralyze that back wall of the trachea and the back wall of the bronchi, which are the tubes that lead off of the trachea to the lungs, that maybe we could keep them from spasming and closing her airway off.
In late March, Rachel had her first procedure at University Health Shreveport. Dr. Weinberger removed some scar tissue and gave her a low dose of Botox.
For the first time the other night, I was able to go and have dinner out without oxygen tubes and cannulas, and I was completely off oxygen for a short time. So that has been amazing.
Rachel has since undergone a second, larger injection of Botox. Dr. Weinberger says he's encouraged by the results, but it's too early to tell whether a drug used to erase wrinkles will erase Rachel's battle to breathe. For the University Health News Network, I'm Ed Walsh.